Okay, so in terms of what to do with your premises, as it says here, you have several options when deciding what to do with your premises upon retirement. So the first option, which is what everybody looks at doing, I think, is look at trying to recruit new partners. I think it is a nationwide issue with recruitment at the moment. I think that's why there's so many practices, certainly probably coming to ourselves, wanting us to assist with potentially sale and leasebacks or putting leases in place and things. We get queries on like that on a regular basis, and it's always to do with struggles with recruitment, struggles with buying an exiting partner out or replacing an exiting partner with an incoming GP partner, whatever it may be. There's just real difficulties with the cost of buying a share in a GP practice at the moment. I mean, I think a lot of practices are looking at other ways. So other partners, alternative partners, paramedic partners and pharmacy partners are becoming more and more popular. They're along the same lines as nurse partners and practice manager partners who've been within partnerships for a number of years now. They're coming more and more common. So there are alternative partners that you can turn to. There are also alternative ways to try and get partners to join. So you can do things like a gradual buy-in, which is what we've heard of a couple of partnerships doing now. So incoming partners, rather than having to buy 100% share in the premises, can perhaps buy a 20% share every 5 years until the full ownership is purchased. So certainly other ways to go about finding partners, and it is a real challenge, I think, at the moment, with most practices really struggling, and partnerships whittling down to maybe 2 or 3 partners and getting dangerously close to that last partner standing issue, which I think a lot of practices are worried about. So one of the options that practices come to us about and query about is potentially sale and leaseback. So sale and leaseback is where, rather than finding incoming partners to purchase to buy into the practice, you would sell the practice to an investor. Sell it to an investor, put a lease in place. You'd still run the practice, you'd still hold the contract to provide medical services as normal, but you just wouldn't own the premises anymore. It'd be a leasehold premises rather than an owner occupied one. Or you could look at putting a lease in place yourselves. So rather than selling the surgery to an investor, if you wanted to keep hold of that asset, as I said earlier, then you could look at putting a lease in place yourselves. So where the exiting partner would become the landlord and lease it to the incoming partner. So we're going to look at both of those options in a little bit more detail in a moment or two: sale and lease back and putting a lease in place. Another option would be merging with another local practice. So if you have a practice perhaps with a younger set of GPs, they could look at coming acquire your surgery. It's called a merger, but technically it's an acquisition, where they would acquire your surgery, take over your patients, take over the contract, and run the practice on your behalf. Obviously, you could join the partnership if you want. So perhaps two sets of 4 partnerships could join together to be an 8-person partnership, and then when partners leave, it's not as bigger issue with the other partners looking at buying the exiting partner out, or looking at trying to find alternative partners to come in. So the bigger the practice, the easier it should be. So mergers are certainly an option, not something that we can assist you with, but certainly something that perhaps your local ICB or your LMC or even Tyne Health might be able to assist you with in terms of what the process is from that point of view. Something else that we can assist you with is transferring the contract to another entity. So practices who perhaps don't want to take on the liability of owning or of running a practice, they could look at getting an alternative provider to come in and take over the contract and be leaseholders as well, effectively. So that can either happen at the start of the process, at the start of putting a lease in place, or at the start of sale and leaseback, or it can also happen midway through a lease term, which is what a lot of practices look at doing, is when they've run out of partners, if you like, and the practice is looking at potentially folding and closing down, rather than going down that route, looking at transferring the contracts to another entity, maybe a local GP Federation, PCN, or an alternative organisations as well. So we'll talk about some of those options in a bit more detail as well a bit later on in the presentation. And then the last option is closing the surgery down and selling the premises. Not really anything that any of us want to think about. It's certainly one of the main reasons why we've put this webinar together, is to help hopefully provide options to practices to avoid having to close the surgery and disperse patients and cause disruption to the community, etc. Not something that anybody wants to do. So hopefully some of these options will help you avoid that option. One of the downsides to selling the surgery on is because you're going to have to sell it as an alternative use, as an alternative, perhaps a residential or a retail or a commercial entity. And there's a very good chance it'll be worth less as one of those alternative uses than it is as in its existing state as a surgery. So even from a financial point of view, in terms of maximizing the value of the building, it's probably better for it to remain as a GP surgery and then sell it on as a GP surgery rather than close it down and try and sell it on as an investment opportunity, a development opportunity, which can sometimes have a significant detrimental effect on the value. Just to be clear, it can sometimes be more, but quite often it is significantly less.